everyone, welcome back to another episode of Be a Nurse They Said. My name is Lainey and I'm so happy that you're here. If you're new here and you haven't gotten the chance to, be sure to hit that subscribe button so you can stay up to date on all the videos and shorts that I post on this channel. Last week I gave tips on resumes and cover letters since people are going to start applying for nursing positions when they graduate in the spring. So be sure to check out that video so you can update your resume and your cover letter and be prepared for your interviews. This week I'm going to talk about interview tips and skills so you can nail that interview and get the job. Interviewing can be very overwhelming and stressful, but with the right tips and the right approach, you can stand out and you can get the job. My first tip is to research the hospital and the unit that you are applying for. Be sure to look up their mission and their values, their philosophy. See if they're magnet status so you can talk about that in your interview. Research the patient population of the unit. If you're going to work on a heart failure floor or a urology floor, research those things so you can be prepared to ask questions and answer questions in your interview. And then be sure to highlight the required skills for that unit. So I just mentioned urology units. They're going to have a lot of continuous bladder irrigations. So if you don't have a lot of experience with that, make sure that you're looking that up and researching it before you're going for your interview so you can speak to it. My second piece of advice is to prepare for common questions asked in interviews. They may ask you to describe a time that you worked as a team to resolve a problem. This could be something that you encountered in clinical in nursing school. This can be something maybe where you worked on a group project and had a problem that needed to be solved. This can be something outside of nursing school at a job that you work somewhere else, but just some time that you worked as a team to resolve a problem that was occurring. They may ask you to describe a time that you used critical thinking and or prioritization. This is probably going to be something that maybe happened in clinical when you were on the unit taking care of your patients. Did the patient decline and you had to use critical thinking and prioritize your care? They may ask you of a time that you had to use those skills. They're probably going to ask you, why nursing? Why did you want to become a nurse? Did someone lead you to want to become a nurse? Do you have family that's in nursing? So be prepared to answer why you want to be a nurse. They may also ask you why that unit, and you don't want to say, well, it's the only unit that has a position available. You really want to research the unit and go in with a good attitude about it. Even if it's not the first choice that you want to work on, you may not get your first choice. A lot of times new grads have to start out on night shift, and a lot of times they have to start out on med surg, and sometimes you don't want those things, but all of us have to start somewhere, and everything is a great opportunity. There's a lot of good opportunities in nursing, and you should take advantage of all of them. So when they ask you why that unit, if it is not the unit that you specifically want to work on, tell them that you're looking to expand your knowledge and your skills, so you want to take this as more of a challenge and learning new things. Then they're probably going to ask you about your strengths and your weaknesses. Strengths are easy. We know what we're good at and we can speak to those things. Weaknesses can be a little more difficult. The important thing is that you can potentially spin your weaknesses to be a little more positive. So if you could improve on time management, it may be because you're such a good team player that you're always helping others on the unit and then you get behind on your own work. So just ways that you can make your weaknesses look a little more positive. Don't say things like, I'm never on time, I'm always going to be late for work. That's not going to be a very good thing. But if you can spin your weaknesses that you're working on them and you're looking to improve, the managers are going to appreciate that. Like I said earlier, researching the unit and the required skills. Within those skills, you want to highlight them in yourself. So if you're going to do a lot of intermittent catheterization and you did that in nursing school or as a nursing aide, you can speak to that. Say that you're very comfortable doing that. You've done it a lot of times, and this is something you can highlight about yourself. If you're good at prioritization, highlight that. You have to do a lot of critical thinking and prioritization when you're a nurse. Whether you're on med surg, ER, ICU, NICU, wherever you are, you're going to have to use critical thinking and prioritize. This goes back to the question, think of a time that you use prioritization. Here again, you can really highlight that skill within yourself. I hope that you're all willing to learn. Nurses are learning something new every day. I learn something new every time I still work on the unit. So obviously being willing to learn. You're going to have to take classes to stay up to date with things. You're going to have to do continuing education. So being willing to learn and offering that you're willing to learn is really going to stand out too. This is where you can really use your experience from being a nurse's aide or an extern if you have that experience. If you don't and you have customer service experience, such as being a waitress, really hone in those skills and apply them to how you can use them being a nurse. You definitely need time management and communication skills to be a waitress and work in customer service. You also need those as a nurse. So use whatever experiences you have and really highlight those skills and how you can use them as a nurse on the unit. My next piece of advice is to dress professional. Now, this is a question that you may want to ask HR or the hiring manager. Some want you to come in business attire, but some want you to come in scrubs, because a lot of times after you interview with the hiring manager, you will then shadow one of the nurses on the unit, and they want you in scrubs for that. This is a question you definitely want to ask either person you're talking to. What do you want me to wear to this interview? You obviously don't want to wear ripped jeans, tank tops, sweatshirts, things like that. You really want to look professional and look the part. So ask if they want you to do business casual, or ask if they want you to wear scrubs. My next piece of advice is to be mindful of your body language. A smile goes a long way, so make sure that you're smiling as you're talking to the hiring manager. Make sure that you're making eye contact with the hiring manager and not looking down or at the wall constantly. You want to make eye contact so they can know that you are engaged and you're listening and paying attention. When you get there, you definitely want to give a handshake. Make sure it is a nice firm handshake to show that you are confident in yourself. The other thing that you want to do is avoid arm crossing. All right, that makes it look like you're not interested. If you're slouching, your arms are crossed, it looks like you're not engaged, you're not interested in the position. Keep your hands on your lap or on the armrest. Just don't have your arms crossed, because that doesn't look good. My next piece of advice is to actively listen and give clear answers. Try to be concise in your answers and don't ramble on. If they ask you a question that you can't answer or you don't have an answer to right that second, it's okay to ask them, can I have a minute to think about that, and then we can come back to that question. It's absolutely okay to ask for some more time to think, because sometimes it's hard to think of an example on the spot like that, so you need a couple minutes so you can move on to the next question and then come back to the one you needed some time on. But just be sure that you are actively listening to the questions that they're asking and giving clear, concise answers. My next piece of advice is to ask the hiring manager questions. This can be things like, what kind of support do you give new grads on the unit? What is the nurse to patient ratio on this unit? Is there opportunity for career advancement? What kind of continuing ed or certification classes are offered? This shows them that you are willing to learn and want to keep growing and being better. And then also, what are the opportunities for involvement? What kind of committees are on the unit? What kind of shared governance can you get involved in? Managers love to see people who want to be involved in things and make a difference on the unit and within the organization. My next piece of advice is to send a follow-up email to the hiring manager, just thanking them for their time and that you look forward to hearing from them. This should be done within 24 hours of the interview. My final piece of advice is to conduct mock interviews before your actual interview. This can be done with a fellow student, a family member. This can be done in the mirror with yourself, but just practice answering those interview questions so you can be clear, concise, and not ramble during your actual interview. Have your answers ready to go and show that you are prepared. It's also important to know your resume. The manager usually has a copy of your resume there, or you can bring one along, and you want to be able to speak to the things on your resume, so make sure you know what's on there. It's also important that you stay calm, and doing a mock interview can help you stay more calm during the actual interview. And it's important when you're at your interview to show eagerness. Show that you want to work there. Show that you want to be a nurse. Show that you're interested in being better and learning and growing and always up for new opportunities. So be sure to use these interview tips when you're going into your interviews. Please let me know if you have any questions. I wish you all good luck on your coming up interviews. I know you're going to nail them and get that nursing job. If you have not already, be sure to hit that subscribe button so you can stay up to date on everything Be a Nurse They Said. Also be sure to like and comment on this video. Let me know your thoughts. Also be sure to check out my TikTok and Instagram account so you can stay up to date on all things Be a Nurse They Said and all the shorts that I post on those accounts. And as always, don't just be a nurse, be amazing like I know you all are, and I'll see you next time.